what we have today is the information giving station. Information giving station, it can be breaking bad news or whatever. This is the first scenario, is splenectomy in child. If you read the script, you can see it. It is about Smith, is 9 years old boy, injured in the park mean garden, admitted for splenectomy, and consent was signed by his father. His mother is angry, and at this time, the child is in theater, operative theater, and both parents are separated, mean divorced woman, as child father is alcoholic, mean drink a lot of alcohol. Patient hemoglobin is dropped from 9 to 8. His abdomen rigid. He had fracture in the lower left rib. Situation was explained to his father, who signed the consent form. The consent was taken by another doctor, not you. You met the patient mother in the emergency department. So the data here, available data, is you are another doctor. The who signs the consent is the father, and the who takes the consent is not you. You met the mother in the emergency department. The patient is in theater now, is operated by your consultant. Usually this is angry mother, so is coming, she's standing, usually standing, she refuses to sit down, and she is insisted to look in or to see his child. So when you're ready, you can start.
Okay.
Okay, so you found the lady, usually the actor is standing. So she met you in the, what's it called, in the venue or the station, standing.
Okay.
So what shall
Okay.
you do?
Hello, my name
Yes,
is Dr. Muhammad. I'm
yes,
one of the surgical doctors.
yes,
I'm here to discuss your child's case with you.
yes. Where is
Could
my
you please?
baby? I just need to meet him.
I can see how this is very stressful condition for you, but can you please have a seat so we can
No,
discuss
no, no, I
everything?
don't sit. I must see my son. So
Yes,
she
it
is
must be.
insisted to standing. Yes. So what?
I'm so I'm sorry, but I need you to have a seat so I can discuss the
No, no,
case with you.
I don't sit down except after I see my child.
In this case, Dr. Shireen, should I
Uh-huh.
insist for the patient to sit, to have a
No,
seat?
if insisted, you are in bad situation. You just tell her one sentence from the script, from the scenario. In this one sentence, she knows that she can sit down. If you don't tell this sentence, she don't sit down. So what you need to tell her? Yeah, what you need to tell her so the patient sit down.
Mm,
She need to see her son. So he shouting, I need to go to see my son. So this is
mm.
the scenario. So she's standing, you are standing, you are
Okay.
both standing. You need to sit down and she need to sit down. So you tell her one sentence from the script. If you tell her this
Yes,
sentence, she sit down. What you tell her?
that her son's in the theater.
Okay, just
Uh,
tell her we don't allow to see her. Your son is in theater. Okay.
okay.
Once you said that, she sat down because it is in theater. So me and you not allowed to go to the theater because he's in operative
Okay.
theater now. If you tell this, the patient sit down and the station become calm and easy. If you don't tell that, you are shouting, and some students say, I don't speak to you except you are sitting down. Shall I bring you water? Shall I bring your tissue? Shall I bring something? So nothing happened except after you need to ask her. It is impossible to see him. He's in theater. Not allow for you to go to theater. All right. So get the
Okay.
point.
Yes, I get.
After that, we have some simple question. So, where my son in operative theater? So, what is the operation? She ask you.
Okay.
What is
What
the name
happened
of
is
operation?
it's an exploration. It,
What you mean by
what
exploration?
Yes, what happened is that your child apparently fell while climbing, and he unfortunately injured himself.
No, no. I ask you,
Uh,
what is the operation? Your consultant did it. What is the name of operation? What is what is the operation? I know that it is exploration, but what he will do?
Mostly he will do a splenectomy for
So removal
roughly
of a spleen. So he removes the
removal of the
spleen.
spleen.
Okay, can tell me what happened, and she need to remove the spleen. From the script also is written. So what happened? What is the
So
cause of this injury of the
you
spleen?
yes, your child injured himself in the park, and
Yes.
he had the fractured left lower lips, which are adjacent to the spleen, causing injury to
Okay.
his spleen.
All
Uh,
right. So the answer is my son in operative theater. What is the operation is explore the abdomen and most probably remove the spleen. What happened during he play in the park? They have fracture ribs, and this rib is adherent to the spleen, which is soft organ, so can easy injure it. Okay. So who signs the consent for the surgery?
okay, apparently his father had
As
brought
father.
him,
So
and he
why
had
you
signed
don't
it.
ask me to me or wait me to sign the consent?
Unfortunately, your boy was it's an emergency operation, and we had to take him urgently to the theater as injured spleen is an emergency because of the possibility of intra-abdominal bleeding.
Yeah,
So
I
my
know,
colleague,
I know that, but why you don't wait me till I will come and sign the consent?
so my colleague had take the consent from his father, and
All
the
right. So I
patient
ask
was
you
need
in the different way, doctor, is this patient need a consent or not?
no, it's an emergency.
All right. So the answer, actually, in this emergency situation, we don't need the consent either from you or his father, but because his father is bringing him, so we explain the situation to his father. But in emergency situation, in critical, I like bleeding or many operation, it's just consent from two consultant. Okay, so this is the answer. So it is not the father, not the mother. Even if both is not present, the baby will be or child will be in theater. Okay, so who is doing the operation? Is your consultant? It is an expert in this operation.
Yes, he is in good hands.
Okay,
Uh,
so what is the spleen? You mentioned they remove the spleen. What is spleen?
and spleen is an organ which has important functions in the body. It acts as a defense against infections. It helps
Okay,
remove unhealthy blood components.
so where is this organ? If you can draw, or you don't need to draw, so where is this organ? Right side, left side?
It's in the left side, in the left upper quadrant in the abdomen here, and I
Okay,
can show here by pointing on my abdomen.
okay, or you can draw it easy. Okay, so it is against the function of it. It is what?
It acts as a defense against infection, and it helps remove the unhealthy blood components.
All right. So how did you know that spleen is injured?
Your child had hemoglobin drop, and during the first scan,
What
we
is fast
found
scan mean?
intra-abdominal during doing an abdominal
No, no,
ultrasound.
it is correct. Fast scan is correct. If you don't tell her, she tell you, I see that they tell me that they make a fast scan. What is fast scan? Because this is exam is also we need
Focused
your
assessment
sonography
knowledge.
for trauma. Okay.
Yes.
So by fast scan, all right. Okay. So what happened if not removed? Suppose we don't remove it. What happened?
If we don't remove it, it may lead to serious bleeding,
Serious
uh,
bleeding and the patient can die.
life-threatening bleeding, and the
All
patient can
right.
die.
So why you don't remove, just remove this part which is damaged and stop bleeding and leave the rest of spleen? Can do that.
Yes, I believe my consultant will try his hard to do this, but
No, it is
if
common operation, doctor. It is a common operation that you have, like partial splenectomy. It is common done or not common?
in
You
children it
see
may be done, but it's not common.
in what?
In children, it can be done, but it's not common.
You see it before.
No, I'm a cardiac surgeon. I'm not a general
Okay,
surgeon.
so it is not common
But I asked
operation.
my friends.
Okay, no, it is
Say in
not
children
common
they try to.
operation. Okay,
Okay.
so of course, I heard that I Google when I came in the taxi, or so I found they have grading for rupture spleen or injured spleen. So how to know this grading of spleen? You know how many grade for injury of spleen?
Yes,
Grade
there
like
are.
1, 2, 3, 4, 5. It is 5 grading. Grade 4 and 5, you need to remove the spleen. So you see
Yes,
this picture.
yes, I can see it.
Okay, so you see it. So how to know this is which is 1 or 2 or 3 or 4 or 5? How to know that?
If there is by ultrasound, by the fast
No
scan.
ultrasound don't show
No,
this.
no, 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 not ultrasound. Sorry, sorry. By
by
CT,
by city. So it is by city.
by
All
CT.
right.
Sorry.
Okay. So what is the long time effect for removal of spleen, doctor?
After removal of the spleen, the patient becomes more susceptible to infection. So he need to take long-term to take vaccinations
What
and
is the
take
name of this
long-term
vaccine?
antibiotics for encapsulated organisms
What is the name of encapsulated organism?
like Haemophilus influenza, Neisseria gonorrhea, and Neisseria meningitidis,
So
Haemophilus
it is pneumococcus, meningococcus, and
pneumococcus.
H influenza. Okay, you mentioned antibiotic. So what you mean? How long we give him antibiotic?
As your child is 9 years old, so according to guidelines, he will need to take antibiotics till the age of 16.
16 mean 1 6.
Yes.
Okay. So you found it is logic, doctor, to give a patient antibiotic for long time.
Of, Mm.
I know that in some books they write that, but it is logic or not logic?
I don't know.
Okay, any one of the audience, it is logic, it is practice done in your country or not?
No, it's
It
just
will be difficult for
giving
the patient.
giving antibiotics until the patient's being vaccinated.
So he can vaccinate it tomorrow, no problem. All right.
So that's it.
So back to the question. You can give antibiotic prophylaxis antibiotic like three dose. Like if you say to the examiner, I give antibiotic till the age of 16.
Mm.
So he are you sure? It is logic or not logic? Any other one apart from you are cardiothoracic. It is logic.
No, not at
Compliance
all.
will be very hard for the patient to be compliant for this.
Okay, so this is wrong answer. We don't give the patient in the past before vaccination. We do that sometimes. In some books they write 9 months. Some books write till the age of 25. Some books they wrote about if the patient have chest infection, I give 2 years after. But I think after vaccination nowadays the vaccine can give long immunity and can give booster dose. So we don't give the long life antibiotic as far as I know. Okay, because it is not logic and is not practical. So you can ask in your hospital or any hospital you work, if do that, just tell in my hospital we do that. But in
If I
general,
ask it, okay. If the
okay, you
examiner
can.
asked me for how long the antibiotics will be taken,
No, it is just 3 doses. I give prophylaxis antibiotic. Usually we don't ask, you tell, but what we give as any surgery, we give prophylaxis antibiotic for wound infection. I give 3 doses. Like within the
okay.
before anesthesia, half an hour or 1 hour, what we call it prophylaxis antibiotic, not long-term antibiotic. We don't use this policy nowadays. Although
Okay.
some old examiner can accept you, but it is not practical. As a time of the money, as a time of the patient take it for long time is not logic. Okay, so is there any alternative, any lifestyle change affect his study? So is this removal of spleen can make him handicap or not?
No, he he has to take precautions to avoid sports and injury in the first year. Also, he had you have to be alert for any fever, for any
Okay,
stay
you mean
away
chest
from
infection.
substance
Apart from, I just
contagion
ask
infection.
you, he can be handicapped or he can go to school, he can go to
Yes,
swimming,
he
he
can
can
go
do.
to school.
Okay, so he is not handicapped. He can have his activity. So of course it is not affect his lifestyle. It's just little modification. So I just ask you, doctor, because you know me and his father is divorced because he's drink a lot of alcohol. At the time, is when he signs the consent, he's not oriented or drowsy or something like that due to the effect of alcohol.
Of course, لا, we don't take usually we don't take consent from someone who is not oriented يعني, and he
Okay,
is not
so this
fully
is the correct
understanding the case.
answer. Because what is the other student says? The other student says this answer, which is wrong. Like, I don't take the consent is taken by other doctor. It is true, it's taken by other doctor, but whatever the doctor, he don't ask him to sign if you found the patient have no capacity to sign the consent. So of course it is not drinking at the time. He's fully conscious, he's oriented at the time of taking the consent. Okay? All right. So you know
Okay.
that my son also they hurt his knee because his father take him in the weekend. So I need to complain. I need don't allow him to take his child. So what is your opinion?
My opinion is that I'm sorry. Of course, I'm sorry for that, and my opinion is that you have to inform the relevant authorities to ensure your child's safety, and we will assess whether the child is safe at home.
Okay.
Additionally, we
So
may
so you tell her I just notify the social service. Okay, that's good. All right. So I am now in emergency department. So where I can wait?
okay. You have we have an a waiting area in
Theater,
front
in
of the
front of the theater.
operating theater.
Okay,
Yes,
all right. So this is a good answer. So of course you don't, she don't stay in the recovery room. She don't stay in operative theater. She don't stay in emergency room. So it is a waiting area in front of the theater. Okay. So you found it is easy, no problem.
yes, yes.
By the way, we don't
But
have.
a little bit tricky in the standing situation that she's refusing to sit. Also, yeah, breaking bad news had to be like gradual. and يعني لولا ان حضرتك قلت لي اللي احنا المفروض نقول لها على طول ان هو في الثياتر، وده منطقي الصراحه. هي فعلا كده،
لا هو
فدي الحاجه الوحيده اللي
I tell
هتقعدها
you
فعلا.
what is the other say and they fail. This is the station is the killer station because some
Yes,
students say what you know about your child case and have no idea. It is not a
yes.
case of the you have a patient in the what is called in the clinic and to ask him about detail. So she have no idea. He just take a telephone. Your son is in a theater or in hospital. Okay. By the way, we just inform the social service. Till now, we don't have a vaccination card or a special card for patient remove the spleen, except if you are in your country or in some city in Egypt. I don't know if we have this card for splenectomy, but we don't have a card for splenectomy. It is not like hemophilia. Hemophilia have a card, but this is have no card. And we don't call the child protection service and all this. This is not our job. Okay. Any comment about this station, by the way?
Oh, ممكن any one question to
Yes.
Dr. Shireen.
Yes.
So I have to tell her that she has to tell the authorities, the relevant, not me.
No, authority is social service, so can contact the social service. Social service can manage.
Okay.
Social service is the office in the hospital. It's called social service. We
I
don't call
can
the
contact
police. We
social
have
service.
something like
Okay.
social service, like
Okay.
Ministry of Social Service in some country. Okay.
Okay.
So anyone need to ask? I think Doctor, are you Dr. Muhammad Ghunaim? Dr. Muhammad Salah, you need to ask or you need to take the second case?
Second case.
Okay. So the second case is also common and also one of the difficult station, which is the patient have malignant ascites. I share the screen now. So this is very, very, very common station. You are, you know that Mr. Gary wife came today to meet the consultant, Mr. Mann, to discuss her husband case diagnosed as malignant ascites. The patient just admitted 2 days ago. Only done for him is basic blood investigation, fine needle aspirated cytology from ascitic fluid. He is not a smoker, not drinking alcohol, occasionally drink alcohol. One of the staff told him yesterday he has advanced cancer and incurable, and he's in the late stage. CT is not working today. Who is not working, some hospitals say it is broken. Broken not mean broken like damage. Broken mean not working. It take few days to be fixed. The patient brother live in Australia and just have coronary bypass few months ago. You are core training or CT means that houseman or junior doctor came in behalf of the consultant as a consultant in emergency room. We have abdominal aortic aneurysm. It is a major vascular surgery. Okay, so you read it slowly. You can write your notes and we can start. Also, this is angry wife also. All right, okay.
I am Dr. Muhammad Salah, one of the surgical doctor. I
Yes.
have been asked today to talk to you about your husband case.
Yes.
Do you want any question about your
No, I
husband
just
case?
waiting Mr. Mann. Where is Mr. Mann?
I'm so sorry, Mr. Mann. There is an emergency case.
My husband also is an emergency case and the critical case. Some of the doctors say he will die. So what is the critical case they have? You need to explain to her why she is not coming.
Mr. Mann have a case. There is bleeding from big vessel in big vessel injury, and he have to go for the emergency theater to repair
So
this vessel.
you mean that Mr. Mann have big artery injury called aorta, and this is life-threatening. So if the patient is neglected, he will die. You mean that?
Die, yes.
You need to explain that. All people know aorta. Aorta is famous name, like coronary.
Yes.
So they have a major vascular. Okay. All right. So doctor, you can speak in behalf of him. All right. That's good.
Yes.
So are you sure that my husband had a cancer, advanced cancer? Your friend tell he's have advanced cancer. Are you sure?
Yes, his lab investigation as some cells from his fluid in abdomen gives
So
the
it is
result.
by one
the
test,
malignant.
simple test in one day, you know that he has a cancer.
Yes,
Are you sure?
yes, sure.
So is any error in this cytology?
No.
No. Where is the cancer cell come from?
Up till now, we didn't know the source of the cancer, but his advanced case because
So why you don't know the origin of the cancer and you tell him that it is advanced cancer. Also, you don't know the origin.
because the cancer cell spread in his body and reaches the abdomen and the abdominal fluids. So it is advanced cases, and
You mean that it is advanced means the tumor have primary side and this is what we called it spread to other side, what we called it metastasis.
Yes.
You mean that?
Yes.
Are you sure?
Yes, sure.
All right. So are you sure there's any definite cure for this patient? Because the doctor, your friend, say is advanced case. Any cure for that?
No, we didn't know any definite cure for this condition.
So what is the treatment option for him now?
And now it is a palliative treatment. We give him a supportive measure as intravenous fluid, as painkiller.
So who will take care? Who is the department who is treat him?
We will refer him to oncology department. to give him the
Okay.
ability to treat
For what? You refer for oncology for what?
oncology department.
Yes, for what?
In our
For
in our
chemotherapy, for radiotherapy, for what?
this is
Chemotherapy can be chemotherapy or radiotherapy, usually chemotherapy. Okay, so why you don't open his abdomen and remove the tumor?
there is no need for that because it is will not change his condition, but he will expose to risk of operation without any benefit.
Okay, so they tell me that you need to do CT for him, and CT is broken. Broken means not working. So, what is your opinion? Is this hospital only have one CT?
Yes, our hospital have one CT, but the condition of your husband doesn't need urgent CT because it is
Can we
will not
transport
change.
him to other hospital just to make
No
CT
need.
and to confirm?
No need.
Are you
Because
sure? Okay.
this condition is advanced case. Yes, I am sure it is advanced case and will not change the plan for treatment.
All right. So shall I call his brother to come from Australia?
Yes, I agree with this, but after his after discussion with her doctor about his condition, because I know he have some sort of operation bypass for vascular bypass.
Okay, coronary bypass. Okay. All right. Okay. So after that, what you need to tell? You finish?
Yes. Do you need
Okay.
to ask anything? Anything?
No. Tell you still have to mark what you need to do.
I will now summarize the condition to you. Your husband have what's called malignant ascites, which is the spread of malignant cell in his abdominal fluid, and he need to refer to oncology department to start his treatment about radiotherapy or chemotherapy.
You mean what is this treatment called it?
Chemotherapy.
No, before chemo, it is called palliative therapy. Okay. So if this is actually, I just worried because they have dyspnea. What shall we do for this dyspnea?
We can do some what's called the aspiration of fluid to decrease amount of it.
You mean acidic fluid, aspiration of acidic fluid.
Aspiration
Okay.
of acidic fluid.
All right. So, of course. All right. Okay. So I hear sometimes, maybe not in this case, some tumor can be improved by chemotherapy. So which tumor can improve by chemotherapy? I Google it. I found one tumor, only one tumor can improve by chemotherapy. Lymphoma can improve by chemotherapy. So I think this is the only curable tumor. Can be lymphoma?
I didn't think that because lymphoma doesn't spread to.
Because no large lymph node mentioned and all this. Okay. Of course, also we only treated this condition if the patient or tumor, if the patient have lymphoma, he can improve, or the patient have something like tuberculosis, he can improve, but because he have malignant cell, so not improve. So a good performance, Dr. Muhammad Salah or Muhammad?
Muhammad Salah.
Okay, so you know why the student fail in this station? What is the cause of failure?
حضرتك قلت لنا يعني common mistake it is early to say it is malignant.
Okay, and most of the students usually insisted to know, okay, we have a solution for CT. We can go to other hospital, we can do MRI, we can do ultrasound. So the main concern of the student in this situation is how to apologize for CT is not working and what is the alternative of the CT of not working, which is not our issue. So for many years, this is a common station, but the most of the students concentrate, okay, we are sorry, we are a small hospital, we only have one CT, so we try to send him by ambulance to the nearby hospital, or we can do ultrasound, or we can do MRI. So whatever you did, and you know the origin of tumor is not much important. Okay, so this is why we just need to explain to her, sure it is a cancer, and it is advanced case because it is mean spread or metastasis of the cancer. Okay? Any question about this issue?
دكتور شيرين ازي حضرتك؟
Yes, الحمد لله.
كنت عايز يعني هو احنا ما ينفعش نهرب من السؤال اللي هو لو انا مش عايز اجاوب دايركت مثلا ان دي كانسر ما لهاش مخرج ولا
لا
عشان في
مخرجها ان
malignant
انت مخرجها ان انت you failed an exam.
لا انا ماشي
انت عايز تقول لها يعني what you need to tell her يعني what you need to tell her عايز تقول لها ايه؟ بص هي الكيلر answer it is so early to tell you that. This is the killer answer. Killer mean kill you because it's already you take a cell you found under microscope it is adenocarcinoma which is a common is like Rockenberg tumor. It is not so early. It is a cancer, so it is malignant ascites, so it means it advanced. It is like the patient have cancer breast and have malignant pleural effusion, so it is advanced case.
بالظبط يعني
ده شغل المصريين.
Yes.
Egyptian work شغل المصريين.
Yes. So this is the station. You know that the station when repeated in exam is not mean that it is easy. It means that we don't reach the level of the all student answer it correctly. So we still bring it till become all the student answer it correctly. Our aim is just to avoid this common mistake. So don't be equivocal. It's so early to tell you that. We don't sure. Sorry for the CT. All these are against you, against the NH system, and it is not good in exam.
ولا حتى مثلا اقول ان هو for more confirmation مثلا ما اقولش too early دي اقول for more confirmation.
What you mean by for more confirmation? What you will do? What you will do?
ان انا اقول مثلا لازم نعمل سي تي او مش لازم نعمل سي تي.
if you do CT and it is found it is a cancer colon or in female can be cancer ovary or cancer stomach, it is Rockenberg tumor, malignant ascites. What is the difference in management? What's the difference in your decision? Is become less advanced?
لا تمام.
Okay, you need to be sharp. Because if you are equifocal, it is not against. Because in this country, if your patient have a cancer, they said, Mister, you have a cancer. Okay. And it is bad prognosis because you have cancer pancreas, for example. Okay. So, yes.
طب أنا ممكن أشارك.
Okay, you can. What's your name?
أنا محمود زهرة.
ده سي.
Okay.
أنا هسأل بس سؤال بيه.
Okay, اسأل.
على نفس الحالة دي.
Okay, you can
the
ask.
patient خلاص we delayed the CT because the CT scan is not working, but it will work and he will be rearranged for another appointment. صح؟
No, but because the patient, if you tell this, the actors, I heard from the nurses, the CT take 2 weeks to be fixed. Okay, because you know the actor in exam have what we called it option. If you say something like, okay, we do the CT in the nearby time, so the nurses tell me it take about 2 weeks to be fixed.
Okay, so
the idea okay.
The idea of the CT.
Say again.
يعني قصدي ان انا السي تي كده بالنسبه لها هيبقى obsolete مش هعمل لها سي تي خلاص.
No, you can do it, no problem, because you know that the doctor need to know what is the origin. For me, for example, I need to do a list of tumor marker. I need to know the origin.
Okay.
But it is not make a difference in decision because our decision now is to give to aspirate the ascitic fluid. We can give palliative chemotherapy or intravenous support or something like that because it is advanced case. But we can do CT later. We can do MRI. We can transfer to other hospital, no problem. But it's not urgent. It's not difficult. Don't what is called change our decisions. So you don't say, for example, I make CT, so I remove the tumor. I found the tumor. So suppose you have a tumor in the stomach and the patient have ascites, you don't remove the stomach, except, or you don't remove the colon, except if the patient have intestinal obstruction, you need to do something.
Okay, so I will still have the CT and the MRI and the change of يعني to redirect her, but it will not affect the prognosis or the management of this case. but still
Okay,
she will gonna
because
have that.
it is medical exam, so it is not.
اوكي تمام شكرا لحضرتك.
All right. Okay. So I think I share. So Dr. Sahra Mahmoud. Dr. Mahmoud. Okay. So this is 32-old traveled to attend the rugby match. Back from his trip, he has car accident. Left side upper abdomen and the lower chest is very painful when he take a deep breath. After A, B, C, D, according ATLS, evaluation, chest X-ray, fast scan, it show fracture of the left 9, 10, 11 ribs and splenic hematoma. The patient admit under observation in surgical ward. The patient, of course, is stable, resuscitated, everything is okay, no comorbidity. He is young. The patient insisted to leave the hospital in evening as he will have important interview tomorrow morning and he can affect his job career. So you are Dr. Richard, the ward nurse call you about this situation. So this patient now stable, vital sign is stable. He have only fracture left 9, 10, 11 ribs. They have splenic hematoma. Everything is okay. No free fluid in the abdomen, and the patient is stable. Okay, so you can start. All right.
هو اسمه ايه
You are Richard. Whatever, if you forget your name in exam, either you found in paper in front of you or just write your name. Just speak that I am Mahmoud. Okay.
Okay. Hello, I am Dr. Richard,
yes.
One of the surgical doctor here. I was told that you want to leave the hospital. Can I
Yes.
ask you why?
Because tomorrow I work in business, so tomorrow I have interview with a big company, is international company. They promote me, they give me good job with big salary. So I need to leave the hospital to attend to have my dress, my take my suit and go for the interview tomorrow morning. So it is important for my life and career.
Well, I understand your concerns and congratulations for your condition and your job.
You mean my job, but not my condition is accident.
My job, sorry.
Okay, all right.
Your job, and I see that being in the hospital is a bit frustrating. But as you know...
No, it is not frustrated. I am happy, doctor. It's okay. All right. Okay.
Also, you know that you had a recent accident, and actually you injured your spleen. Spleen is an organ in your left tummy, and
so what happened to be injured? What is the cause of this injury?
There is a collection.
No. What is the cause? Why this spleen is injured?
Because there is a fracture ribs in the left side, and this because of the accident actually.
Okay, so it means that the rib fracture is affected the spleen and cause something called, you mentioned it is hematoma. What is hematoma?
Hematoma, it is a collection of some blood under the capsule, under the coverage of
the capsule. Capsule is okay. So okay. What is the treatment option? We have no treatment. What's the treatment option?
The treatment
what
option,
you give me here now?
I understand your question, but actually, for now, your condition is stable, and you want.
No, what is the treatment of my condition now? What is the nurses give to me?
Some medications for the pain, and
so painkiller and
some medications
and
like
the fluid.
And the fluids.
Okay, and also I think they give me antibiotic and ask for chest physiotherapy.
Okay.
All right. So what is spleen?
Spleen is an organ in responsible for removing some toxins from your body, and actually it's help in defending your body against some organisms or
bacteria. Okay,
bacteria.
Doctor. So I can take this medication and the painkiller and can go to home. So why you insisted to stay here with you in the hospital?
I understand that you have an important situation, important.
No, apart from my job. So why I am here, not go to, you know, I found
because if
many
there
of
is,
my friends, they went to home. So why I stay here?
because if there is you have an injury on your spleen, and the haematoma makes it stable, and if you in any time that collection may cause internal bleeding and will affect your health. And
So you mean that this hematoma can be rupture and cause internal hemorrhage and can cause hypovolemic shock or something like that, and I will die.
okay.
You mean that? Okay. So what shall we do now, doctor? You don't solve my problem. We just speak with me. What shall I do?
You better to stay under observation.
So what shall I do for my interview tomorrow?
I will call. I will send a letter to your HR, and
No, if you send the letter, doctor, it's take a time. This is tomorrow. Now it is 9 o'clock now. So the interview is tomorrow. If you send the letter, it take a time.
So I will call him and and explain your condition and give you a sick leave.
No, I don't need a sick leave. I don't have a job to take a sick leave, doctor. Give me something I can solve the problem. Something can be fair for me. You call the manager. So
I will call the manager.
Yes. So what shall I do? How can I must have the interview tomorrow. Any option, any suggestion from you?
I will call the manager and I will explain your condition to him.
Yes, but I need to attend the interview.
I will offer. I will convince him to postpone.
Doctor, you are in close circle. I think you are young and know the technology and everything. Give me two options. One old style option and one new option. That's it. Okay, so if, either we can call him and make the interview through the Microsoft team or the online. This is the first option.
أنا ممكن أقول كده.
I tell you the other option, and after that you choose. And second option, which can be suitable for you. Okay, so you can stay with us. You ask your mother or your wife to bring the suit for you. So tomorrow morning, by the ambulance, we take you. You go to the company. After you finish the interview, you are back again. Okay. So now you have two options. One option is go to by ambulance and the ambulance with him. Second option, by online. You agree?
Totally agree.
Okay, so I don't need a sick leave. The patient don't need a sick leave. He don't need a letter. The letter take a time. So either personal communication or you can give any answer is accepted.
Okay.
All right. So you need to be logic. You couldn't be too practical.
بس المشكله الدكتور حافظ الحته دي من اللي هي arthroscopy patient فحطها هنا صح يا دكتور؟
كان صح. Usually it is common in exam. We have arthroscopy is the next one. We have some student answer me last time in India. They have a scenario for the UTI and the frequency of urine or prostate, something like that. And the student, many students insisted that this patient have urine retention and to insert a catheter. And we don't have this at all. All right.
This patient not working, but in arthroscopy case, he is working.
I don't remember, but it is important to know that each case is different and your answer is according to what happened in the patient. All right. Okay. So who's next? I think if you finish, just remove your hand, put your hand down. I have a lot of scenarios. So who's else? Ahmed Fathi, you need to join or whom?
Yes,
Doctor. Okay. So Dr. Ahmed, we have the common scenario, which is patient postpone arthroscope, I think is really very known. The female, 45 years old woman, obese, working in supermarket, had a tear in one of the right cruciate ligament, maybe anterior, posterior, I don't know. She took many painkiller, caused gastritis. She had appointment today, an arthroscope with Mr. Arthur, who is called for an urgent compound fracture with vascular injury. And you are Richard, orthopedic, SHO. Mr. Mann, the consultant, asked you to explain the matter. I think this Mr. Arthur. Okay. Mr. Arthur asked you to explain the matter to the lady. Okay. All right. I think this is different. I just need to make it back. Okay. All right. So just read it again and we can start. Okay, you hear me?
Yeah, I hear you. I told you what, just the call is ended by mistake. I can.
What? Say again? Say again.
The call is ended by mistake. Just join right now.
All right. Okay. So again, it is 45 years old woman, obese, have cruciate ligament injury. She have take a lot of painkillers. She have gastritis, and Mr. Arthur today is have emergency operation with a vascular injury with fracture femur, and Mr. Arthur ask you to speak to the patient.
Okay.
Okay. All right.
I can begin?
Yeah, can.
Yeah. Hello, I'm Dr. Richard, working for Mr. Arthur.
Where is Mr. Arthur? He gave me appointment many time, and today the nurse tell me they postpone the arthroscope. It is simple operation. It maybe take half an hour. So why he don't? Why today I don't have my operation to be done?
Sorry, but Mr. Arthur has been called away for emergency case. So
what is emergency? I know that in orthopedic, no emergency. You have a fracture. My husband have a fracture femur, and he stay in hospital for 2 days, and the doctor fix it in the 3rd day. So I think, for my opinion, in orthopedic, no emergency. It is true, doctor?
Yeah, but Mr. Arthur has been called away for a compound fracture, which associated with some vascular injury, which can make the patient in a dangerous situation, as he can lose his life.
All right. So you mean what is lose his life or his leg?
It may be complicated by either losing his limb or losing his life.
No, not life. He can lose his limb because of vascular injury. Okay, so because you know that in orthopedics you don't have much emergency, but because this patient he have vascular interference, so if he not the vascular interfere and the orthopedic fixed the leg, so maybe he lost his limb but not his life. All right, okay, I agree with you. So all right. So what shall I do now?
Till now, we will postpone your.
Yeah, but I take a leave from my manager. I work in supermarket, so I take a leave today, and I take one week leave. So what shall I do?
I totally understand your situation. Right now, I can write a letter for your employer. Your operation has been postponed again.
Okay, so in this situation, you can write a letter, and the patient can go back to the supermarket, give the letter to the manager. Okay, yes. So this is a different situation. Okay, of course, she does not need a sick leave. So what you write a letter, and she is back to the work. Okay, after that, what shall we do?
Also, I can call him for you if.
No, you will call him and give me a letter. No problem. Thank you. What else?
Also, I can arrange another appointment with Mr. Arthur to arrange another time for the.
No, I don't need appointment. I just need the date of the another arthroscope. So can you please ask your secretary, just she can contact me and give me the date. All right? Okay. So any advice from you?
You have strongly to make some non-weight bearing exercise to making your muscle being more active, and to keep you in a more suitable condition for the operation.
I go to nearby club. I go to swimming. She is okay for me.
Yes, it is.
Okay.
advised.
So swimming, physiotherapy, some exercise, reduce weight. Okay, can give me painkiller.
You already on a painkiller, but if you
No, I stop it because I have a gastritis and the pharmacist give me omeprazole, proton pump inhibitor. Can
yes,
you give me painkiller?
Yes, I can arrange for you some more stronger painkiller, but I can go for my senior to ensure that. And,
No. Is a stronger painkiller means that is more gastritis.
Yes, there is a painkiller which can cause stomach upsets, but I can offer for you some different type of painkillers that can.
Okay, this is wrong answer, doctor. You know what is wrong? If you give me something better, so why you don't give me the better from start? If you know some medication don't cause gastritis, so why you give me the bad medication and cause gastritis, and now you correct your mistake and give me painkiller not cause gastritis?
According to WHO letter.
What does WHO mean?
World Health Organization letter.
I don't care by WHO. So
to our guidelines.
Okay.
احنا بس بنبدا بنون سترويدال بعد كده بنخش بويت.
No, they already the patient take a painkiller. So in this situation, so I don't give you painkiller because it is dangerous for you. So I don't give you painkiller. I just can give you some ointment, some cream, something like that, and we give it to you soon. Because one of the big wrong answer, I give you better painkiller, not cause gastritis. What is the painkiller not cause gastritis? What is this?
I think it mean opioid, but
no, we don't give opioid to patient in outpatient clinic like tramadol or all this.
Yeah.
Okay, you can have some patch, like distalgesic patch. If you know this patch, like painkiller patch, cream can, but we don't. If the patient asks you, can give me painkiller, sorry for that, you already have a gastritis, so put you some cream, we can give you some patch for, it is also slow release painkiller, but it is not, it is like opiate or something like that, because other opiate injection is not allowed out the hospital. Okay, so doctor, don't be so clever. If you say about WHO and all this is not our business.
Yeah.
Okay. Yeah. All right. Any comment? Yes. So it is easy station, very common.
But I shall
yes.
prescribe any medication other than ointment and patches, and
up to you. If this patient in severe pain, okay, so I can admit you and give you opiate, but you need to be admitted.
Okay, Mr. Shin. Okay.
Okay.
Can I refer to the physiotherapy, sir? Can I refer the patient to the physiotherapy?
Yes, already physiotherapy, some exercise, reduce weight, but as soon as possible, we ask you to come for arthroscopy.
Okay, and regards to the gastritis issue that you have, should I prescribe something?
No, already some doctor give her omeprazole. Last time is proton pump inhibitor.
Okay.
Okay, this is easy station. Does not take 5 minutes in exam, so it is just easy because some station is just to relax.
I have a question, sir, but it's not regarding this question. In regards to
you can
confusion, confusion pre-operative. A patient is confused in the word pre-operative to her elective surgery. Should I perform the full many mental status examination with the full questions?
Okay. You ask me from surgical point of view, this is exam is surgical exam or medical exam?
Surgical exam.
Okay, so you found that many status or all this abbreviation is we use it in surgical practice?
Not really. We use the Glasgow Coma scale, and sometimes, we can just.
It's something you don't use in your practice. Why you need to use an exam?
Okay.
Okay,
But-
so what use in your country? This is the next scenario. But what use in your country? In your medical school, what use to evaluate the patient status?
The Glasgow Coma scale.
No,
If-
Glasgow
if-
Coma scale, it is a scale. But how to know this patient is okay?
Alert,
What is the
verbal,
first?
and
What is
AVPU.
no. In your medical school, what is the first sentence you learn to know this patient is okay?
She can recall her name, her age. Where is she?
What's this called?
Oriented.
Oriented to what?
To time,
To
place,
time,
and person.
Okay, that's simple. Orientation to time, personal, time, place, and persons is okay. All right. Don't be so clever. It is the easy way to fail. Okay. If we don't mention do this scale, we don't ask you to do it. If we need you to do many mental state, we ask you this station to do. We have this station in the past. We have this is one of the station, but not for confusion. It is just if any patient, we need to evaluate his mental state. So can use many mental status. Okay.
Okay, sir.
So we have this. The next scenario is this. It is like post or pre-operative confusion.
ممكن سؤال يا دكتور؟
Okay, you can ask.
يعني لو الستيشن الغذائي الستيشن دي خدت وقت قليل دي حاجة وحشة ولا؟
لا هي تاخد وقت قليل because this is 17 station. Exam is actually you have 17 station and the 2 preparatory station and so 19 and about 3 rest station. So it's 21 station. So 21 station in 10 minutes. So it is about 210. So it is near 3.5 hours. So if we don't have a station for relaxation, so you will be exhausted. Most of the station exam is 17 station, 7 station, all pass in it. Simply because it is simple and because the student know what is happened in the station.
Okay.
It is just one of the policy of the exam. Who is next? So who is asked about confusion or many mental state?
I did, sir.
Okay, so you can answer this. So I share the screen or not?
Not
No.
yet.
Not
No.
yet. Okay, so we share it. So what you have? Okay. So 75 years old or year-old woman admit to hospital for redo elective total hip replacement. So redo elective total hip replacement is not fracture neck femur. It is just replace the total hip. It is a metal. And she had an operation done 15 years ago. You are core training like houseman, doctor asked by senior to consent the patient. Your name is Gandhi. Whatever your name, you are SHO orthopedic. You found the hair confused. Okay. So
Okay.
this is what you need, doctor. This is what is written in the script. All right.
I need the patient. Okay, I need the patient to consent to be able to have the capacity to consent.
All right. So we don't mention do many mental state. We don't mention anything. Okay. So the aim of this station is this patient have perioperative confusion, yes or no? Difficult to take consent or easy? Capacity to have a consent? Test for confusion through orientation to person, time, and place. Okay. So whatever
Okay.
technique you can make, we accept it. Whatever you need to do, you can do.
Okay.
All right.
Okay, can I start?
You can start. Yes.
Okay, hello. My name is Dr. Gandhi. I'm one of the surgical house officers here at the hospital.
Yes.
I'm just gonna confirm your name.
Yes, I am Anne Mary.
Okay, nice to meet you, Miss Anne Mary. Can I call you Anne?
Can, no problem.
Okay, just I was asked to ask you a few questions, and if we can to sign down a consent form regarding your condition. Would that be okay?
Okay, can.
Okay. Do you know where are you right now?
Yes, I'm in hospital.
Okay, and do you know what time is it to the nearest hour? Or
No,
what
I don't
time
know,
is it
but I
of the
know it
day?
is the morning.
Okay, that's perfect. And what year is it?
No, I don't remember. Longer time, I don't
Okay,
have
and
newspaper. Okay.
it's okay. What's your date of birth?
Date of birth is 23rd of December. It is 75 years ago, so it is about 1950.
Okay, and okay, and do you remember when the World War II ended?
No, I don't word. I live in the Malaysia, so I just away from this world war. Maybe I don't know.
It's okay. It's okay. So I'm gonna tell you an address right now. Okay, can you just
Okay.
I'm gonna tell you a sentence. Just
Yes,
remember
can.
it. Okay, 24 West Street. Okay, I will ask you that
Okay.
at the end.
Okay.
Okay.
Yes.
Okay, and can you count down backwards from 20 to 1?
20 to 1. No, it's difficult to me.
It's
Okay.
okay. So you don't have to do that. Okay. Do you know who's the current Prime Minister of the UK?
No, I live in. I know Mahathir because he's ex-president of Malaysia.
Okay, that's no worries. Okay, can you please tell me what is the address what is the sentence I told you to
You
memorize?
mentioned something West Street, 24 West Street.
Okay, that's perfect. That's more than perfect. Okay, so now I'm gonna just read you down the operation that you're going to have, and
Yes.
afterwards you're gonna just summarize what I've said, and that you know all the risks and all the complication that may happen from this surgery, and why
Okay.
are we doing the surgery itself. So I'm gonna
Okay.
explain to the patient the surgery itself. I'm gonna fulfill every point. I'm gonna repeat if she has allergy, what kind of medication she's on.
No, you speak to me or to speak to the patient?
No, I speak to you, sir. Okay,
No,
I'm gonna return
you
back.
finish the conversation of the patient.
Yes.
Okay. All right. So you are away from what is we need from you, doctor. Okay. So I tell you,
Okay.
what is your opinion about this patient?
She's allergic. She's oriented to time and place and person.
Okay. So suppose she is not alert, what it could be?
Could be an electrolyte disturbance. She could be diabetic. So she.
All
missed
right.
her
So it is
dose of-
diabetic. So you asking me about diabetes.
Yes. I meant when I was asking about the allergy and the medication history and other surgical conditions. So I was just about to ask those questions to the patient.
You can
But
ask. You don't finish
Oh.
yet. So you need to continuous.
Okay. I'm sorry. Okay. So okay. Do you have any chronic medical condition
Like what?
like diabetes or hypertension or asthma?
Yes, I have diabetes and I take oral hypoglycemic. I take metformin.
Okay. And were you admitted to the hospital before?
No, but I regularly go to my GP for this.
Okay. And do you have any allergies regarding any medication?
I have allergic to seafood, so you need to ask about allergy to medication and food. Okay. What else?
Okay. You told me that you took you're currently taking metformin. When was your last meal?
Last meal I take because here in the hospital they give me insulin, so I don't take metformin. They give me insulin through the pump.
Okay, that's perfect. So I'm gonna. Okay, thank you so much. And do you have any complaints right now? Do you have any diarrhea? Do you have any fever? Do you have any nausea?
No.
Okay, and do you feel your heart racing or anything?
No.
You can lay flat on your back without an issue?
Yes.
Okay, perfect. Okay, so I'm finished with the patient right now?
No. Doctor, you are away from what we think it is for the MRCS. Okay, I tell you first.
Okay.
First, what we supposed to do here? What is supposed to be to do? This patient, we need to know it is conscious or have a capacity to sign a consent or not. Okay, so you're reluctant to ask is about history. Okay, you need to ask about all item of history. Okay, like family history, social. You don't ask me about smoking. You don't ask me about alcohol. So maybe I drink alcohol, and this is withdrawal of the alcohol because in the hospital they're not allowed to drink alcohol. Because you enter this station, you have the belief it is for many mental status scoring. You have this impression. I am true? But I tell
Yes,
you
sir, yes.
what shall you will do. What you will do, you start as normal way. So you start first, good morning, what's your name? What is your, or how old? Or what is the date of birth? Because sometimes you know the date of birth, or you can know how old, no problem. What time now? Remember the address you did it. What is the year? What is the place? You ask me about the word 2. Suppose you are exam in Egypt. You know that the people in Egypt know what is the time of the World War II?
Okay.
So it
yeah.
is not a suitable question. You ask about who is the minister of the UK, or it is not logic also. But you can ask a simple question. What is my job? I am a doctor. What's this? It is a nurse. Okay, you see the screen.
Yes, sir. I can see it.
Okay. After that, current president can, whatever, current king, counting from 1 to 10 or 10 to 1, not 20 is too much. You give her some, just give her like Tahrir Street or some easy address. After that, you need to ask about nausea, vomiting, fever, regurgitation, coughing, loss of appetite, loss of weight, bowel movement, other system, chest, heart, micturition, because it is like a complete history. You take a complete history from the patient. Past history of chronic disease and the medication, past admission, family history, allergy, social history. So now you have an idea. Not necessary to make it in AMETS or many minimal status, but you have an idea, because this patient at the end, they have something. Either we can say it is not orientation. I can give you bad mark, so I say it is not oriented. Yes, I agree. I ask you wrongly. But what this patient can have, this patient maybe have trauma at his house, affect her head, maybe have infection, maybe have metabolic disorder which is common like hypoglycemic or any failure or hypothyroidism even, maybe hypoxic, maybe hyperthermia, maybe on medication, and this medication causes this problem. Of course, the common in all this is head trauma and hypoglycemia. And after that, you can see I will ask for investigation. I make lab investigation, blood sugar, kidney function, all this. And I think if this patient is not, suppose I tell you wrongly, I tell you I don't know what is year, what is date, so what is your opinion now? I say you wrong answer. So what is your decision?
In regards of this patient,
Yes.
you've already answered me wrong. Then I'm gonna postpone her elective surgery. I'm gonna find out. I'm gonna measure her blood glucose level.
Okay, so
do
you
some labs.
postpone. So just first, you postpone her surgery. Why you postpone the surgery? Because
it's an elective surgery, and we have to get to the roots of the patient
all
confusion.
right. So this is after you make the investigation. Who will take care with this patient?
I'm sorry.
Okay, so you can see the screen now. After the lab investigation, after chest X-ray, CT, head, skull, so who will treat this patient?
The medical registrar.
Medical doctor or medical team. Okay, so the idea here, we don't mention you in the statement do many mental status. Just take a history, just exclude hypertension, exclude medication, exclude hypoglycemic, and at the end, just tell the patient, okay, it is elective surgery. I think we ask for investigation or tell the relative, and after that, we will medical doctor and we take the medical advice. So maybe this patient have just hypoglycemic coma or something like that.
Okay,
I have a patient. She came as a psychiatric patient. She admitted in psychiatry, and after 1 week of the, psychiatry have a lot of tests, and after that they ask for CTs. They found they have hematoma in her brain. Hematoma in the frontal lobe makes psychological disturbance. We just evacuate the hematoma. The patient become okay. All right, what you need to ask?
Yes. So حضرتك دلوقتي بتقول ان الستيشن دي انا هعملها كانها اي complaint, فالconfusion is part of analyzing the complaint itself, whatever
yes.
the
it is history taken station. You take it as history taken station because one of the common cause in old age for confusion is either hypoglycemia or electrolyte disturbance.
تمام خلاص اوكي شكرا.
Because it is not a psychiatric exam, but in some station we can find the same station and they write you directly, would you please do many mental status score? Can. It is happened, is not common, but happened. If anyone attends the exam, have this station about confusion, and they ask him to do many mental status, apart from you hear from your someone. Okay.
انا
So,
سمعت حد من زمايلي قال لي كده.
all right, okay. So suppose you come to me in my exam and you do that. Shall I stop you or not stop you? What usually is the attitude in exam? What you think?
You don't stop anybody, sir. You just
All
leave the
right, so
candidate.
I leave you. So whatever you need to do, you leave you. But I have in mark or in checklist, he don't ask about social history. He don't ask about smoking. He don't ask about diabetes. He don't ask about medication. So he don't ask about loss of weight, loss of appetite. So he don't ask about other system because it is important to look for the patient as general. You are not a psychiatrist. It's not a psychiatry exam. Okay? All right. So it is important take care because one of the trick of this exam, we have a common mistake running generation. So because the one of our mistake also, we don't stop you. If you do something wrong, because of the British culture, usually they so don't ask you, they don't blame you, he just give you a mark. All right. Agree? But if you ask you directly, can do many mental state, you can do it. Okay.
Sorry, doctor, but when we will many mental status examination, or it have no role in our exam?
It is not you can check in your syllabus. You don't found it, but we have some stations. We called it in the past to have something called pilot study, pilot station. So we put in it, and sometimes they will bring it instead of the cranial nerve examination. So if written, you can do it. It has happened once. I think Dr. Muhammad Omar, they have this station. He examined it in UK. They have it once, but it is insisted. They written in the instruction outside, would you please do many mental state for this patient? She is confused.
But if not written, I don't go for many mental status examination, and I go for AMTS only. So just it.
I don't know much the difference between both, but it is, you mean that orientation to time, person, and the place is okay. Because it is not possible to the patient in Malaysia or Southeast Asia know who is the king or who is the queen or who is the World War II and all this.
No, I mean many mental status, which is a 30 questionnaire. I asked it from about year and about building and about extract 7 from 100 and writing a bisecting in pentagon like this 13 question.
Okay. No, I think we don't ask this. We don't ask like this.
Okay.
So
Okay.
so it's been as simple as possible.
Yes, it's just to take it simple, but the important for me is to take a history. So just take a history.
طب سؤال يا بيه معلش، كان في
قول.
ستيشن جت لحد كان العيان بلايند dementic and on warfarin.
I don't trust this because we don't have a patient in the scenario is blind and dementia, but you can take a history also.
Okay.
Okay. All right. I heard about this, but we don't have this station because we don't change the station. But sometimes the patient, the candidate have some beliefs and they can transfer her to the other.
طب
Okay.
لا هو معلش يا بيه، هو لو dementic وهو in warfarin وانا بحاول consult about the warfarin اللي هو bridging between I'm explaining all the warfarin station يعني.
You mean that you stop warfarin and give him Clexane, for example?
Yes, sir.
So what is the problem?
If he's dementic, so I need to admit the patient?
Yes.
Okay.
But is the station is to take a history of the capacity of the patient or to treat the patient?
I think it's counseling about warfarin, switching between warfarin and heparin.
Okay, no, you can't tell the patient. I think this station is physiology, and who take it is misunderstanding what happened.
Okay, sir.
All right. Okay, but we don't, if the patient you need to counsel about medication, we don't bring him up confusion. I check for it also, by the way. Okay. So it is important just to treat the patient by medical registrar. Okay. So I think we have another two easy.
Okay, I'll take one.
Okay, you can take it. It is just patient is not coming more common. It is, I just share the screen. I just check this patient refuse. So it is 15 years old girl, complain of pain, lower abdomen, brought to hospital by friend, diagnosed as acute appendicitis. She waiting her mother to sign the consent. Her mother refused to sign. You are Dr.
Okay.
Richard, and so she's patient have acute appendicitis. Her mother refused to sign a consent. Okay.
Okay.
All right.
Okay. Hello.
Hello.
I'm Dr. Richard, the SHO of the surgical department. Can I ask why you are refusing?
I am the mother of Anne, and he just have a call, and she said to me she need to have to remove her appendix because they have acute appendicitis. So what is your question again?
So why wouldn't
So you ask me first what you know about this condition. So I tell you, I know that my daughter have pain in her abdomen and diagnosed as acute appendicitis, and the doctor here asked for laparoscopic cholecystectomy. Okay, so what is the next question? What is your question?
we need to sign a consent for your
No,
daughter.
I refuse to sign the consent. I refuse to sign the consent. So what is your question?
Can I ask why you are refusing that?
Because I Google, I found you can give my daughter antibiotics so they can improve by antibiotic.
Okay, I understand that, and I appreciate your concern, but in her specific case, we will need to do that operation to remove the appendix.
So
that,
you don't give her antibiotic, doctor, or you give her antibiotic?
We start giving her antibiotic.
So you already give her antibiotic. So can
Yes.
tell me what is the treatment given to her?
Yes, we've started with the IV cannula, and we started with the fluid management and antibiotics with
Okay, so you
painkillers.
already give her fluid and antibiotic. Okay, so
Yes.
we can wait, maybe improve with antibiotic.
Well, I believe this is cannot be the proper solution for her condition, because we had our own examination and the investigations that we believe that this antibiotic regimen is not appropriate for her currently.
So what other investigation you make?
We made for her basic lab and ultrasound. The
Abdominal
ultrasound.
Abdominal
Yes.
ultrasound. We don't have the result. If you don't have the result, don't tell me. But what is ultrasound show to you? In other case, not in her case.
Well, the ultrasound shows that in simple ways, or should I?
Anyway, up to you.
Okay, so the ultrasound showed that your daughter's appendix is severely inflamed. And
No,
we
you
know
are speaking. No, the ultrasound can show the appendix or can show any other like ovarian thing or something like ovarian cyst or something like that. So it is important, especially in female. But doctor, till now, you don't tell me why you insisted to do laparoscopic cholecystectomy.
Well, we prefer laparoscopic because
No, I don't ask why you prefer laparoscopic in comparison to open. So why you insisted to do the operation, whatever the technique?
Okay, if
Do
we
you
are
understand
delaying,
what my question?
yes, if
What
we
is
are
my
delaying
question?
that, it is why to remove the appendix itself.
Okay, yes, why we remove the appendix?
okay, we are removing the appendix because if we leave the appendix in an inflamed way, this will make some, it will precipitate in a sequel that the appendix itself may perforate. And if it is perforated, the pus inside this appendix will spread into your daughter's abdomen, and this will be like a serious condition
So
to
what
be
you mean by
considered.
serious? So this my daughter can die if this appendix is perforated. You mean that?
Unfortunately,
So what
it
is
could
the
be,
cause
it
of
could
this?
happen. She will go into a septic shock
What is
if you
septic?
want me
Yes,
to.
okay. So what you need to tell her, okay, antibiotic is good. We already give antibiotic, but not all case improve by antibiotic. So in some
Yes.
cases, the appendix is perforated. The content of appendix come to the cavity of the abdomen. We call it peritoneum, cause inflammation of this peritoneum. And in some condition, even with treatment, can cause some, we call it sepsis or septic shock, which is the blood pressure is drop, the pulse is high, and the patient have fever, and many cases can die in some centers, or some cases can die from septic shock. Okay,
Yes.
so if the patient refuse, you ask her why refuse. Of course, nowadays, by the way, if you Google, you can find in some centers they do already medical or antibiotic regimen instead of surgery. Is still under trial, and many research done for that. But just to tell her the complication. So if the patient refuses the operation, whatever the operation, if refuse laparoscopic cholecystectomy, refuse laparoscopic appendectomy, whatever he refuse, tell the complication if not operated. After that, okay, I will sign the consent. Just tell me what you will do for this operation. Can just tell
Yeah.
me what you'll do for my daughter. So what items you need to tell me? Okay.
First of all, she will take the anesthesia in a general anesthesia.
General anesthesia, yes, good.
Yeah.
After that,
And we will start, or we'll start with laparoscopic surgery using tools through ports
okay.
with the small incisions in the abdomen. And you have to know that if it is technically difficult, we may convert this operation into
Okay.
open.
So you have general anesthesia, start by keyhole or laparoscopic surgery by 3 small opening, each opening about half to 1 centimeter. In some cases, may be difficult to change it to be open surgery. So suppose it
Yeah.
is still laparoscopic appendectomy. For how long she will stay in hospital?
With laparoscopic surgery, if there is no perforation found intraoperatively, she can safely discharge the next day or
Okay, is any
to
stitch done
home.
in her abdomen? Is any stitch? Yes,
It could be
yes.
one stitch, yes,
No, they
inside
have a
her.
stitch because you have 3 ports, so you have at least 3, 4 stitch. So where
Uh,
and when I remove the stitch? Where and when?
Actually, the inside stitch are not removed; they will
No, I
dissolve.
don't speak about the inside. Don't be so clever. I speak about the skin stitch. When and where you remove it?
In the outpatient clinic.
In the outpatient clinic or near GP after how many days?
It's about 7 days.
7 to 10 days. Okay. Any complication in this surgery? Any one to
For
complication?
any surgery will have it might have complications. So yes,
Like what?
infection to the wounds can happen.
Infection, fever, bleeding. So if this infection happened, what shall I do?
You should come back to the hospital or consult your GP.
Okay, come to the hospital at any time, even in the weekend. And we give the
Yes.
patient the contact telephone for the hospital. In some hospitals, they have a brochure or paper is about what is the possible complication, what's the contact number. You can come at any time, day and night. Okay? So the idea here, if the patient refuse, just ask why she refused, and after that, ask or tell her the complication. So it is
Yes.
just simple way. Okay, we have the last. After that, we speak to you. The last is patient consent for OGD. Any volunteer?
I can share غنيم.
Okay. Yes.
أو ما فيش حد تاني.
All right, Ken. So this is 55 years old man, chronic smoker, complaining from frequent attack of heartburn. The surgeon in charge to take a consent from him for OGD. OGD mean esophagus, gastric, and duodenal, plus or minus biopsy. You are Dr. Richard, the SHO. Okay? All right, you can start.
Hello, I am Dr.
Yes.
Richard, one of the surgical doctors,
Yes.
and I am here to explain everything you need to know about the procedure you are going to have.
Yes. What is the name of procedure?
Okay, the name of the procedure is OGD, esophageal-gastroduodenoscopy.
Okay, it
his
is just
name.
upper endoscopy, just to be simple, so it is
Upper
endoscopy. All right, what is the value of that?
Okay, the value of that is after we are inserting like a small camera in your mouse.
No, I
reaching
just the aim of this. I don't ask about the technique. The technique is the next question. What is the value to do camera test to me?
to see
To
inside your
visualize the esophagus, stomach, and
visualize
duodenum,
the
and
esophagus,
to see
stomach,
what,
and the duodenum,
and to see
and see
any
the structure
lesion,
and
any
any lesion.
tumor. What else?
And if there is any structure, it can be therapeutic also by dilating it.
Don't be so clever. What else? You just visualize the tract, esophagus, stomach, and duodenum, and
Taking
what else?
biopsy if we need it.
If we have any tumor or ulcer
Tissue
or
sample.
lesion, I take a. What is
Can take
biopsy
the
mean?
tissue sample.
What is biopsy mean?
Means a tissue sample.
Say again.
So we send it tissue sample.
Tissue
We send
sample.
for we send it for lab.
What you
for
mean by lab?
analyzing it.
No, what you mean by analyzing? Just for examination under microscope, for histopathology examination.
Under microscope.
Okay. So for histopathology examination or examination under microscope. So you can take a biopsy, you examine under microscope in the histopathology specialist. All right. Okay. Can you
see
tell
the stem
me?
Again, Dr. Shane?
Yes, again?
Can I see the stem again? Can I see it again?
Okay, you see it now.
Okay, thank you.
Okay, so can you tell me about the procedures?
The procedure involved inserting a small camera in your
No,
mouse.
doctor, in surgery, if you mention any operation, what is the first thing you mention is position.
Okay.
What is my position?
You'll be in the left in the cubitus position.
Left lateral position.
Left lateral position.
Left lateral position, and after that?
We will give you light sedations and the IV fluids.
How to give me, like, doctor, through cannula. So you put a cannula, yes. Give me sedation. Can give me the name of sedation?
The name?
Name. Something like midazolam. Something like Valium. It is short acting, midazolam or whatever. Something like Valium. Okay. After that, we give you oxygen and they will continue to monitor. How to give me oxygen, doctor? Although you put something in my mouth.
Through the nasal cannula.
Nasal prone. Okay. After that, how to know this oxygen is reached to my lung? It is working.
We usually monitor the saturation of oxygen in your blood by a device called the pulse oximeter.
All right. Okay. What else?
We will use a local spray in your mouth.
What is the name of spray?
Lidocaine.
Lignocaine or xylocaine spray in the mouth. Okay. What if you put something in? No. Before introduce, you put something in my mouth. If you like how to introduce it, I can
mouse guard.
So okay. So again, you are in the left position. You have nasal prone. You have pulse oximeter. We put a cannula. We give sedation, and we put local xylocaine spray and put mouse guard. After that, we put the camera. So just to swallow it, and you can see everything. Okay. So it is easy. So you mentioned sedation is, so this is painful procedure, doctor?
No.
So you give me sedation.
as
What
you-
is the name of
yes.
sedation?
The sedation is short acting, like Valium or midazolam.
Midazolam, but I think it take a time. So we have a reverse of it. Maybe the examiner ask you, what is the antidote of midazolam?
Flumazenil.
Flumazenil. Okay. So we have midazolam, flumazenil. It's just to know that because it take a time. So all right. So I came with my car. So what is any advice? I came alone or can come with my wife to take me back to my house?
No, you have to have your wife. It's good you have your wife to be with you.
Okay,
To
so
drive
you
you
need
safe home
he
safely.
can able to drive. So if your wife can drive, she must come to you to drive you back. It's better to have someone to escort you to home. Okay, so you tell me you can find the structure. If you find the structure, what you will do?
We'll do dilatation, balloon
By
dilatation.
what? Balloon dilatation. Okay, so what is the name of mucosa change nowadays for reflux? What happened if you have a reflux? What it cause?
It causes squamous metaplasia, Barrett's esophagus.
Barrett esophagus is metaplasia. What is metaplasia?
Metaplasia is like the
It changed from stratified
change
squamous
changes
epithelia
from
to be
stratified
stratified
squamous
columnar.
epithelium to stratified columnar
Okay,
epithelium.
so why we need, so if we have this reflux, you need to treat it. Why we need to treat this reflux or Barrett esophagus?
As the continuous irritation may lead to cancer esophagus,
What is the name of this cancer?
adenocarcinoma of the esophagus.
Adenocarcinoma. So if we still have reflux not improved by proton pump and other, what is the name of operation you can do?
Can do lower esophagectomy.
No, not lower. No. Is that nasal laparoscopic? Nasal fundoplication or to be fundoplication or any fundoplication. All right.
عشان في الاول لما قلتها الاسوفجاسترودينوسكوبي حضرتك قلت لي قول لها ان سمبل ووردز فمش عارف
لا ناسن دي عادي اصل هو انت دي دلوقتي انت we asked by the examiner or this is the last question even if the patient is a medical question. What is the complication of these procedures?
Okay. This procedure may lead to bleeding, may lead to injury to your teeth while introducing the endoscope. Also, in some rare cases, it may lead to perforation.
Okay, this is dangerous. So, as a result of biopsy, I take it after how you need me to come back again or not?
Yes, you will need to come back again after 2 weeks to receive the results of your biopsy after
histopathology. Okay. All right. Okay. So that's good. Thank you so much. Okay. All right. So what we need to tell here, because